Welcome everyone to Southern Maryland Center for Independent Living's annual report meeting. Today we'll be reviewing our activities and accomplishments during fiscal year 2022, covering October of 2021 to September of 2022. My name is Lydia Believska and I'm the Executive Director of Southern Maryland Center for Independent Living. I would like to mention a little bit about us and who we are. We are a non-residential, nonprofit, community-based human services organization created by and for people with disabilities. We serve residents of all ages living in Calvert, Charles, and St. Mary's counties. We are an advocacy and information and education center that promotes independent living and empowerment for people living with all kinds of disabilities. As an independent nonprofit, we are governed by our board of directors. They guide and support our staff to provide exceptional services and programs to our consumers. We call the individuals that we serve our consumers, and all that we do here is centered around them. At this time, I would like to recognize our current board of directors. Christina Bishop is our president. Julie Randall is our vice president. Penny Brueggemann is our treasurer. Phil Horn is a member. Jason Scott is another one of our new members, and Robin Cavallaro is our newest board member. And we want to thank them all for their dedication. They are volunteers. They give us their time and their talents and help us move the mission and vision of our center forward. So thank you all. I would also like to recognize our staff. We are small but mighty. As I mentioned, my name is Lydia Believska. I'm the executive director. Pamela Ford is our deputy executive director. Araceli Torres is our office fiscal administrator. Jerry Taylor is our peer coordinator and veteran support staff. Stacy Tobin is our IL and AT specialist. Takia Thomas is another one of our IL specialists, independent living specialists. Renee Moss is one of our supports planners. And Geronda Montgomery is our newest addition, supports planner as well, newest addition to our team. And they're truly an amazing team. I could not do this without them. They have the passion and the drive to help our individuals, empower them every day. And they have really a lot of passion for advocacy as well and inclusion. So thank you all for all that you do. And at this time, I would like to ask Pam Ford, our Deputy Executive Director, to talk a little bit about our services and programs.
You're muted.
Good evening, everyone. I'm going to speak to you about our 5 core services. The first service I'm going to talk about is our individual and systems advocacy. Disability and awareness training to community groups and business is what we call our systems advocacy. It advocates for, and we advocate for improved accessibility, individual and systemic activism to safeguard civil and human services. Self-advocacy training. That means you advocate for yourself. Systemic is advocating on a broad, more national or community or your area of communities group. Sorry, guys. Then we're going to talk about peer support. Peer support is when you provide one-on-one group service support for people with disabilities by peers and mentors with similar or like disabilities to serve as a role model or a support system. Another core service is independent living skills training. It enhances and maximizes the ability a person has with a disability to live in and participate fully at home or in their community. It helps with budgeting, cooking skills, and nutrition. We can provide travel training. We can help with your communication skills. Another form of advocacy, we can teach you how to manage your household and relieve stress management. We also have information and referral services. We have an extensive database of providers and resources on disability and community-related information. We have disability-specific information, and we can refer you to ensure that access to knowledge needed to receive or maintain independence. Another one of our 5 core services is transition services. With our transition services, we assist consumers who are in various stages of transition, including but not limited to transitioning from the penal system, rehabilitation programs, shelters, and homelessness. We have a transitioning youth program that focuses on school-age individuals transitioning into productive, active, self-sufficient, independent adults. These are students that are transitioning from high school to college. We help them become work ready. We help them with benefits and health management, educational conflict management, and we help them ensure that they are connected to services that will help them promote their independence. We also have another program called Money Follows the Person. This program helps focus on transition from an institution such as a nursing home or a rehab facility back into the community. It helps to inform residents about waiver programs that's here in the state of Maryland. It assists individuals who have full Medicaid insurance to meet certain qualifications to transition with the necessary supports. We'll talk more about that program, other programs that can help as well. We also have additional services and programs that helps with Social Security benefits, that help with access to SSDI, SSI forms, SSDI forms, I'm sorry. These are benefits that you receive at Social Security Administration. We help with the initial application and we can point you in the right direction if and when there's appeals necessary. We will help you advocate there at Social Security. We also help provide benefits counseling. We educate you on Social Security beneficiaries about the various incentives that are available that will help them to be employed and continue to receive your monthly benefits from SSA. That's the key, and transition to self-sufficiency. We help you with job search and job readiness. We also help you with application assistance to help you to apply for jobs and with other services such as DDA, Department of Social Services, and with Department of Labor. Let's talk about our fiscal year 2022 and what we did during that year. SMCIL is proud to say that we served 223 consumers. I guess you're wondering what consumers are. A consumer is an individual with a disability who has at least one goal and one request and wants at least one service. So with that being said, we also provided 364 information and referral services to various individuals. It could have been a consumer or a family member or anyone that needed information. Information and referral services are provided to active consumers and individuals with or without a disability. They wanted more information that have been referred by a service provider or anyone who wants to become an active consumer. So let's break down how many consumers were served by the county. We already said that we serve 233 consumers. So Calvert County had 42 consumers, Charles had 88, St. Mary's have 96. And then you see here that there's 7 others. What does other mean? If you look at our pie chart, you'll see 41%. And that little sliver of other is 3%. That 3% is a part of the bigger number because other means they fit into one of the other counties. And they also mean that they either came from one of our sister CILs because the sister CIL cannot serve their staff, or they were a veteran outside of our Charles, Calvert, and St. Mary's counties. Now, each one of our consumers have to have a disability. When you look at other on this specific pie chart, it says 15 because multiple disabilities take up the majority of our consumers. So that's where the other falls in at, because we serve all disabilities: cognitive, mental, physical, hearing, vision. And most of our consumers have more than one disability. So if you look at our pie chart, that's what that represents. SMCIL served consumers over 3 years. Again, if you look at this chart, you'll see in 2020, in 2021, and in 2022, the number of consumers served. In 2020, we served 266 consumers. In the middle of the pandemic, our small but mighty staff never stopped working. We continue to serve our consumers. We met them where the need was needed. Wherever they were, we went. During 2021, our doors were still open. We began to receive consumers in-house. In 2022, that mission still continues. We serve our consumers, we still go out, but they're not as needy as they once were, but we still serve. Let's talk about what the SMCIL network is. And you'll see that network with some of our sister SMCILs in this picture here. We are a part of a nationwide network of independent living centers, one of 7 SMCILs in the state of Maryland. We are supported by the Maryland Statewide Independent Living Council. SMCIL serves St. Mary's, Charles, and Calvert counties, and all are an independent, non-residential, nonprofit agency. Now I'm going to turn you over to Ara. She is our fiscal manager, and she will give you all of our funding sources.
Good afternoon, everyone. SMCIL receives funding from multiple federal, state, local, and private sources. DOORS, or the Division of Rehabilitation Services, is our main core grant funder, as well as our designated state agency. HHS, or Health and Human Services, is another of our operational funders. We have also received funds from COVID-19 relief through grants and acts like HHS Cares, Vaccine Access, ARPA, known as the American Rescue Plan Act, and multiple local COVID-19 relief funds like CDBG, which is the Community Development Block Grant. We also receive funds from MFP, which is our Money Follows the Person, which receives funding through the Maryland Department of Disabilities. We have assistive technology supplemental grants through St. Mary's County and Charles County, as well as private donations and donations from organizations and our fundraising events. This slide shows a comparison of our finances over the last 3 years. Our income for fiscal year 2020 was $404,000. For 2021, $457,000. For 2022, it is $434,000. Now, these numbers are subject to adjustments and closing entries during our fiscal review. We have projected our income for fiscal year 2023 to be around $507,000. Our expenses during the last 3 years are, for fiscal year 2020, $399,000. For fiscal year 2021, $431,000. And for fiscal year 2022, $434,000. Again, these numbers are subject to adjustments and closing entries when we do our financial review and our fiscal review. Now we have moved on to our income for fiscal year 2022. This chart shows the breakdown of our income categories for fiscal year 2022. Our core services grant represent 55% of our total funding. The assistive technology grants represent 26% of our total funding. And the COVID-19 relief grants represent 10% of our total funding. Moving on to our next chart, we will discuss the expenditures for fiscal year 2022. And it shows down a breakdown of our expenses in the categories. It shows that our salaries and benefits represent 60% of our total benefits and of our total expenses, and additional operating expenses are 20%. Assistive technology and pass-through funds total 16% of our expenses. And now Stacy Tobin will now speak more about the assistive technology and pass-through programs that we have.
Thank you, Ara. In fiscal year 2022, our assistive technology program was funded through the Department of Rehabilitative Services, our main funder, and we got a total grant of a little over $67,000. Of that, $52,000 approximately is pass-through funds that benefit directly to the consumer. That means we were able to purchase equipment, devices, do modifications in the amount of about $52,000. And then we got about $15,000 of operating expenses. In 2022, we were able to assist 26 consumers throughout our Calvert, Charles, and St. Mary's County with various forms of assistive technology. Here you'll see the listing of the devices or modifications that we were able to provide. We bought some lift chairs, hearing aids, a transfer board, scooters, a communication device, iPad with the software, a scooter lift, a Victor reader for a blind individual. We built 11 permanent ramps. We purchased a portable ramp. We purchased a stair lift and a knee scooter. And you're going to see some pictures on the next slide. So this slide pictures one of the ramps that we built in collaboration with Christmas in April. You'll see one of the scooters that we purchased. In the middle is our Victor Reader Trek, which allows a blind individual to read books and also use the GPS. The van is a van that we helped to modify for an individual, a young man in a wheelchair. And then that's one of our lift chairs that we provided. We also collaborate with several partner agencies. Christmas in April provided over $28,000 worth of labor to help us extend our funds and our projects that we did with them here in St. Mary's County. Charles County Commissioner's Grant provided a little over $7,000 in funds. St. Mary's County provided a little over $4,000, and the ADF Community Foundation grant provided a little over $2,000. And these grant funds and the labor helps us to extend our AT funds that we received through doors, and they satisfied the contract requirement of 20% in kind. We also have a project called the Statewide Portable Access Project. This is ramps that we got in partnership with Maryland Technology Assistance Program. It was a grant established through the Christopher and Dana Reeves Foundation to the Maryland Department of Disabilities Technology Assistance Program that then was funneled down to all the SMCILs in the state. Southern Maryland Center for Independent Living houses 10 ramps in varying shapes and sizes. We have 2 adjustable threshold ramps, and then we have 8 portable ramps varying in size from 4 to 12 feet. They are loaned out for a period of time of 120 days to residents of Charles, Calvert, and St. Mary's. If there is not a request for that size ramp, if they need an extension, we do often provide extensions as well. The purpose of this program is to allow consumers accessibility to their homes while they're working out a more permanent solution, or maybe their need is just a temporary solution. So they're able to use these while they work that out. And we've been very successful with this partnership over the years. And this year we assisted 8 consumers with loans during the fiscal year. We're very proud of our AT loan library that opened in 2018 with a grant. And then we worked with Maryland Technology Assistive Program to continue that process. The library enables individuals with disabilities to live, work, and learn more independently through assistive technology by allowing them to see and try before they buy the latest AT prior to purchasing. Every year we expand the library with new and updated devices. So in our library, we have devices in the following categories. We have adaptive dining, we have sensory aids, learning devices, listening devices, visual aids, memory aids. We have iPads with lots of different kinds of software. We have specific communication devices. We have computer programs and just a ton of other things. We provide demonstrations. We do short-term device loans. I provide library tours. People can come in and see the entire library, or we can take the devices out to them. We provide trainings and presentations to local organizations, to consumer groups, and we provide information and referral. Now we're going to talk about our housing efforts. We have continued through the HUD 811 program to support 3 consumers and 1 family post-transition into accessible housing through the HUD 811 program, which is a state-funded program with federal money at Calvert Hills Apartments. SMCIL, along with our sister SMCILs, have been providing these services for years, but we have been in discussions in this fiscal year with the Maryland Department of Disabilities and the Maryland Partnership for Affordable Housing to negotiate a contract to pay for these extensive case management services that we've been providing our HUD 811 case managers as case managers. We currently have 29 consumers on that wait list. That wait list is maintained by the state, but we can help people get on the list. And then if they are chosen, we help them through the process. And then once they're housed, we continue to provide case management services. So we're now going to get funding to help us with that process. Now Pam's going to talk about some additional programs that we have. You're muted, Pam.
Thank you, Stacy. Those programs are the Community Development Block Grant. We call it the CDB grant, and also the American Rescue Plan Act, also known as ARPA. As a part of the COVID relief efforts, we were awarded these grants. CDBG grant is through St. Mary's County, and ARPA is through Charles County grant. To assess and evaluate communication barriers that took place during the pandemic, our assessment found that barriers were related to consumers or individuals with disabilities being isolated, the inability to communicate and with their families, and lack of devices to do so. The grants then afforded us to purchase these communication devices and train the consumers how to use the devices, and it eventually removed the barriers. SMCIL specialists completed 4 presentations to a total of 75 individuals. We purchased 1 tablet, 1 desktop computer, 25 laptops with all of the needed accessories. And we're still continuing to purchase devices and trainings for these people. With this grant. SMCIL specialists is provided both group and individuals trainings on the use of said devices. She started out with groups and soon learned that individuals needed one-on-one trainings, and she adjusted the way she provided the trainings to fit the need. Both grants were awarded for a 2-year period, extending into fiscal year 2023. Now, let's talk about our Disabled Veteran Support Network. This support group started a few years ago and has become a collaborated effort with NAVVETS, National Association of Black Veterans, who uses SMCIL's Veterans Training Center to submit veterans claims. SMCIL this fiscal year has assisted 37 veterans to apply for benefits and have had 17 veterans receive favorable decisions. All veterans continue to receive peer mentoring, self-advocacy, and computer skills training here in our Mechanicsville location. Support has been provided via phone to all members and new veterans to accommodate those who are still a little bit uncomfortable about meeting in person, even during our post-pandemic. And we're hoping to restart the DVSN meetings very soon. Now, let's talk about expectations matter. My life, my choice, my plan. What we like to say, nothing about us without us. Expectations matters. My life, my choice, my plan is a virtual training on person-centered planning developed by people with disabilities and their family members. It is a trainer-trainer initiative, a collaboration between Shared Support Maryland, SMCIL, and numerous other agencies in Maryland. Me, SMCIL's Deputy Executive Director, is a master trainer, and Jerry Taylor, our very own peer coordinator, is an active trainer. The program has expanded into West Virginia with the support of all the trainers. SMCIL's Executive Director has recorded a 2-hour person-centered training session in Spanish to make it accessible to others Spanish-speaking persons. This particular training has been done in other languages as well. You can find them on their website as well as on YouTube. In fiscal year 2022, one of SMCIL's transitioning youth and her mom has participated in the program and became paid trainers as well. That's the good thing about this program. If you became a trainer, you actually got paid. It became a paid employee position. And we're hoping to continue that program further. Another one of SMCIL's programs is the Supports Planning Agency. We call it the SPA. The Supports Planning Agency is a fee-for-service subsidiary of SMCIL. The SPA was approved by Maryland Department of Health and began serving clients in February of 2022. The SPA provides comprehensive case management and supports planning services to individuals who are approved for long-term services and supports. SMCIL Supports Planning Agency jurisdiction covers Anne Arundel, Calvert, Charles, Prince George's counties, and St. Mary's. This is one of the programs that have allowed us to cover counties outside of the Charles, Calvert, and St. Mary's catchment area that the SMCIL is assigned. SMCIL started the SPA with one part-time supports planner, and by the end of summer 2022 has added its second supports planner to our team. Per our contract, SMCIL SPA is operating at maximum caseload of 55 participants, and we're hoping to grow that program very soon. We also have another fee-for-service program called the Veteran Directed Care Program, and we are very proud of this program as well. The Veteran Directed Care Program is administered through the Maryland Department of Aging and the Veterans Affairs Maryland Healthcare System to deliver home and community-based services to disabled veterans who qualify for the program. SMCIL was approved to provide case management services through the VDC program in mid-fiscal year 2022 on a fee-for-service basis. SMCIL's jurisdiction for the program covers Calvert, Charles, and St. Mary's counties. Per our contract, SMCIL is allowed to serve up to 5 qualifying veterans per county at any given time. Our first veteran was assigned in September of 2022, and we're hoping to grow that program as well very soon. Now I hand you back over to Stacy for some more exciting news that's coming your way, or has came your way.
Has come your way. That's right. Thanks, Pam. So this fiscal year, we decided that it was time for us to get a new look. So we worked with our IT provider, Balance Logic, and our board of directors to develop a plan to rebrand. The first thing we did is we came up with a new logo. We're very proud of it. As you can see, we kept what we call our little running man and created a logo that embraces our new mission to empower independence.
Thank you.
And then we rebranded our building and our bus to create the new look. You can also see that we changed some of our colors and we got new logo wear. So we're all wearing new blue shirts. We also updated our print materials. So we came up with a new trifold brochure. We redid our business cards. We created marketing efforting postcards so we can send it to our consumers and also to local partner agencies and residents in the 3 counties we serve. We also are very proud to say that we have created a new website, and I'm going to take a little minute to show you our new website. I'll give it a second to come up here. We're very proud that we now have a much more professional looking website as well as a very accessible website. I think everybody can see it's coming up now. Slowly but surely. There we go. So as you can see, this is our homepage where we talk a little bit about the SMCIL and our services and our mission. People can learn about what independent living is, and they can access our core services from this page, as well as subscribe to our newsletter and get contact information. I do want to talk a little bit here about this little button here on the right. This is our accessibility widget. So individuals can come in if they have a disability, or let's say they need our website to be in a different language, they can choose a different language. They can choose an accessibility profile based on their specific disability. So if they're vision impaired, if they have seizures or are epileptic, if they're blind or have dyslexia or cognitive or ADHD, so they can do it recommended based on that specific disability, or they can go in and just change a certain feature, use a screen reader to read aloud. They can make the text bigger. They can space out the text. Some people need some bigger letters and bigger spacing. They can use dyslexia friendly type. They can use a cursor. And just different features. They can change the saturation and the colors based on their needs. So we're very excited that our website is now fully accessible. You can learn a little bit about us, something about us. You can also go to our services from the services drop down and see some of our subcategories under our main services. Check out not only our events, but our fundraising events. Our calendar list places that we will be. So you can see our meeting is listed, when our office is closed, our Disability Veteran Support Network meetings, and any information booths that we may be attending or presentations that we will be making should be listed on our calendar. You can also go to our Support Us page or click Donate and learn ways to support us. We know that we have a lot of funding sources, but we really do still need our community to support us. So this is the way that you can come and learn how you can support us. You can give through our main PayPal giving fund. You can make credit card donations through the Mighty Cause page.
Okay.
You can always send us a check or a money order.
Yeah, we got the light bulb in, the new one in?
Amazon Smile.
I'm
if
good.
somebody's not muted, if you could mute, please, we would appreciate it.
Yeah. Yep, thanks so
Amazon
much,
Smile
Michael.
for the time being.
Thank
And
you.
we always do a Giving Tuesday campaign. Another way to give is giving of your time. We have lots of volunteer opportunities. We're always looking for a grant writer, help with some of our events. We also have a ADF bingo team that goes and sells holders, and ADF gives us funds for those people going and helping to sell those holders. So if you're interested in joining that team, it could be once a month, it could be a couple times a week. Based on your schedule, definitely reach out to us. Let us know. We would love to have your support and your help. And then there's the contact us, ways to find us and to be able to reach us, either email, phone, send a message through our website, see where we are on the map. So I'm going to go back to our presentation. So that was our brand new website. We're very excited about it. We hope if you haven't had time to look at it yet, you go to it, smcil.org, and check out what we're doing. Now I would like to share with you a video that we created during our grand reopening celebration. I'm gonna turn the volume down a little bit just so I can tell you guys what is being seen in case somebody can't see it, but we had beautiful music. The first is just inviting you to our grand reopening. And then we wanted to show you guys the logos over time. So I'll start with our current logo and go back to our oldest logo. We've really made a lot of changes. Tell us a little bit about who we are, that we're a nonprofit organization created by and for people with disabilities. And then we also talk a little bit about our mission to serve individuals with disabilities and empower them to lead independent and productive lives in their community. We have a bus that provides transportation and it got an overhaul. So you can see the old look and the new look. Our old website versus our new website. We did have a building in Hughesville before, when we were Center for Life, and then we moved here to Mechanicsville and we've overhauled our building here with the new logos. We do a lot of outreach events over the years, so you can kind of see how our table has changed with our new logos and colors as we've modified and rebranded. And one of our favorites is the Dragon Boat Festival that we've been participating with for many, many years. And you can see how we've changed and invited some of our favorite volunteers, our children. And that just thanks you for seeing our little video. So that video was created by our IT professionals, Balance Logic, for our grand reopening celebration, which we hosted. on November 16th here in our offices. We invited our board of directors, all of our staff was here just about. We invited our consumers past and present. We invited partner agencies and just the community to come and help us celebrate. We did a ribbon cutting. We had a great spread of food and a wonderful cake. People were able to tour the office and our AT loan library, meet with our staff, and just have some time to kind of reconnect. We also had some consumers where we took their information and then reach out to them afterwards to meet their needs. So if you were there, we thank you for coming. And if you didn't make it, we're sorry, but you can still reach out to us and learn about what's new. Now we're going to talk about those outreach events. Like I said, with our rebranding, our bus got an overhaul. We think it looks great. Our bus is used to transport individuals to our programs, but we also use it for some of our outreach events. So two of the specific ones that we usually use the bus for is our Solomon's Dragon Boat Festival and the Retrofest on the Potomac. And we, myself and Takia, drive the bus and we pick up the participants from their parking and take them to the events and back. Meanwhile, we have staff at the events providing information at booths. We participated in 12 outreach events this year, presenting information and handing out giveaways so people know how to reach out to us. Now, Lydia is going to wrap us up with our accomplishments.
Thanks, Stacy. Thanks, everybody. So I just wanted to summarize some of our accomplishments for fiscal year 2022. Like Stacy just mentioned, we created and implemented a new marketing and outreach plan, including the rebranding, the new corporate and brand identity of our agency through a partnership with Balanced Logic. We thank them for donating part of their services and talents to make this happen and sticking with us through the process. We also increased the AT library activities, including loans and demos through the contract with Maryland TAP, and we did negotiate a new contract for next year. We completed the Expectations Matter person-centered planning training and offered it to our consumers, their families, and other professionals. And actually, we're growing even further than Maryland, offering the training in other states. We continue to support the consumers who reside in nursing facilities through our Money Follows the Person program. We actually provided 6 tablets to local facilities to improve the access for the residents to communicate with their family members, with us as their peer support, and any other agencies that might help them through their transition so they can transition into the community. We continued our COVID relief efforts through the CDBG, ARPA grants, and the goal there was to improve access to technology and communication. We used Relief Act funding to improve access to COVID vaccines, including providing education, information, and assistance specific to individuals with disabilities to promote the vaccination efforts and help in the state, reach more individuals with disabilities. So as we celebrate our successes from fiscal year 2022, I wanted to reflect on our vision and mission that drive our work every day. SMCIL's board of directors and staff members, we envision a society in which people with disabilities are valued equally and participate fully. We advocate for equal opportunities for people living with disabilities. Our advocacy work is driven by the needs and the desires of the people we support. And our new mission statement, which we polished during our rebranding efforts, is to empower people living with disabilities through services and advocacy with the tools to lead self-directed, independent, and productive lives. So with this vision and mission in mind, let's look at some of our plans for the next fiscal year for 2023. We would like to continue to build the supports planning agency and increase caseload capacity. And we would actually like to hire an additional supports planner, which will allow us to be able to receive more assignments, more cases to manage, which will help us grow the agency and make it sustainable. We'll also like to build up the veteran-directed care program and serve more veterans in our community who qualify for the program. We would like to expand the public health workforce within the disability network in our community through the ARPA funds by hiring a social support specialist, and their job would be to gather resources and information for consumers to use in case there are any future emergencies or pandemics. And these are also federal funds that we were able to receive through Administration on Community Living. We would like to increase the reach of our awareness and marketing efforts in our community. We would utilize social media, our great new website, outreach events, trainings, presentations, and all of our personal contacts to do this. We'll welcome everybody's help with spreading the word about what we do. We would continue to expand our AT programs, including the AT library and the portable ramp loan program, to provide more access to assistive technology, including through additional grants that we receive. We would initiate a new service as a regional ambassador for the AT loan program in a program called iDrive, which we have just partnered with Maryland Tab to do. We're very excited. I've already started some outreach around that program. We would provide also extended case management services through the new contract for Highway 11 housing case management that Stacy mentioned earlier through the Maryland Department of Disabilities. And we will continue to provide technology and trainings under the CDBG and ARPA grants so we can combat the social isolation for our individuals with disabilities and seniors as a result of the pandemic. And last but not least, we would restart the in-person Disabled Veteran Support Network meetings. Actually, next month is our first new meeting for after the pandemic. And here you can see our contact information. You can reach us via phone, through our website. As you saw, there's a place where you can subscribe to our newsletter or just reach out to us. Also through our Facebook page or through our info@smcil.org email. Also, our website lists all the emails for our staff members if you would like to reach one of them directly in specific. So that is, in a nutshell, what we were able to accomplish last year. We're very proud of all that we have done, and thank you all for your support. Great staff, our amazing board of directors, all the consumers who participated, our whole IL network. So thank you all very much, and I hope to see you next year.